Good afternoon. My name is Debbie Stenberg. I'm a nurse here at Chester, Illinois, Randolph County. I'm oncology certified and I work in that department at my hospital. I wanted to talk to you a little bit about my presentation I did for Nursing 452. I did a PowerPoint presentation which I will also upload into my discussion. I hope that you can take a look at and review that as well. I chose to speak about or do my presentation about lung cancer screening, and I'll tell you why. I did a windshield survey for my population health classes here at McKendree, and I determined through that in this county there is an increased risk of premature death, possibly related to high smoking rates and also to exposure to dust and chemicals from manufacturing and farming and so on. There's also a limited number of healthcare providers, so there's another barrier that people don't have access. So an intervention for this then is cancer screenings, because then people could enter the program and get to the appropriate point of care that they need, and this also alleviates some of the burden on the actual healthcare providers of the area. So in addition to that, I also knew that in the last couple of years my hospital was working in coalition with Missouri Baptist Hospital in St. Louis to develop a lung cancer screening program, but really hadn't heard too much about it since then. So I spoke to my key players. My first key player was my CNO, and we determined that I would do a presentation that she wanted to release on Facebook, which would be essentially an overview of the lung screening program, and it would be aimed at the population, risk population, which is 50 to 77-year-old patients who have a smoking history and exposure to other chemicals and things that make them high risk for lung cancer. Well, for the purpose of this program, I needed an audience, so I had to use a small group of staff members at the hospital so they could evaluate my program, which turned out to be kind of a mixed result, and I'll talk about that in a minute. But anyway, as I did my further interviews with my key players and then my research into lung cancer screening, I determined that it's not just a lack of understanding and awareness of the population at risk and the population as a whole, but it's also the same for our care providers and just pretty much everybody, because, for example, everybody knows pretty much that to screen for breast cancer we get mammograms, but yet the general as a whole population is not aware of the availability of lung cancer screening programs, or that the United States Preventive Services Task Force has reviewed this and deemed that they are approved for screening for lung cancers, which means that CMS or Medicare will pay, and most insurance will pay for this low-dose CAT scan, which is the actual screening process. So in light of this, that this is a nationwide problem, that even though the American Cancer Society and NCCN and many other organizations have worked with and tried to educate, that since about 2013 they've done all this work and the number of screenings has not really increased. So that is a big problem and a big barrier to this population that's at risk. So I decided then, with all that information, that my presentation was going to change, and it would just include why it was important to be screened for lung cancer, and who was at risk and who should be screened, and then how to access a screening program, specifically my screening program in my area. So a reason why that people should be screened, of course, is because long before people are symptomatic with lung cancer, it can be present and not causing any problems, but at that time it's non-invasive, hopefully, and it can be easily cured with surgery, or sometimes even during the biopsy process, it's small enough it can be just extracted and it's done, as opposed to those people who develop symptoms. By that time, it's usually metastasized or spread or well advanced to some vital organ in the chest that eliminates the surgical removal and is not curable. And also the life expectancy after symptoms is usually less than 5 years. So that was the reason for it. Also, the reason for it was to improve the quality of life and cost and all of those things involved with treating a major cancer. I utilized these pamphlets, which have been printed up by my hospital as handouts, just simply because to give them something to take with them. So as I said, this audience of mine, even though it was skewed because it was a small number of staff employees, and of course the evaluations, they did well because they understood what I was telling them. But on the other hand, if that's a problem that caregivers don't know about lung cancer screening, then now these few people that I've talked to, now they have a better understanding and are aware of the program in our area and can hopefully go from there to use this information in their practice. What I've learned from this presentation is I get very nervous when I talk to people, which I already knew, but anyway, it worked well that I had these things that I was familiar with and could do that. If I did the presentation again, I would do a little more planning and practice of my presentation and have some more information. Also, another thing that I would have wanted to do that there wasn't time didn't allow for is to talk to other areas, other hospitals that also utilize Missouri Baptist or even other screening programs to see what their issues were and how they addressed them and how they made their population aware of that this was available to their people. How this changed my practice, I think it made me understand or have a better understanding of how to work together in an organization, perhaps, and to develop a program and rely on information that I could get from that, and to how to divide it up and work to make some progress instead of just one big, have some organizational skills instead of just one massive program that didn't really amount to anything. So I think that was what helped me. And I think that's all I have. Have a good afternoon and happy holidays.